everyone, it's Nani back with you for a fantastic show. We are getting into the first topic of the day, which is on cancer care. For those of you out there, if you want to give us a call, maybe share or even ask questions, 2282-8578, 2282-8579. Now, we said earlier that we're going to give you some ideas about Mother's Day, gifts. What can you get for your mom? Something different.
Okay, well, right now at number 8, and that would be if she's the chef, you can get her the perfect, of course, tools that she would need in the kitchen, and that would be a favorite cookbook, perhaps.
Right? There you go.
Yeah, all the recipes.
A multitude of cooks out there, really very famous chefs. I know a lot of them would love Jamie Oliver's latest edition of his book, one of those quick easy meal books which Jamie Oliver has come up with. So you can get her one of those. What's the next one on the line?
Well, number 7, the traveler. If she's into traveling and discovering new places, get her the latest in the cameras available, or even better, you can buy her that flight to Hawaii.
A flight to Hawaii sounds much better than a camera, but then again, hey, it depends on your budget.
Exactly.
All right, so now jumping back to the doctor in the studios, we gave you right up to number 8 of gifts, so we'll come back to you in that in a bit. We are going to talk about cancer care and what you can do for family or friends who are probably going through a really bad time. Let's welcome our guest in the studios. We've got Dr. Nick Chong Chung King, Consultant Palliative Medicine Physician, Harley Street Group. Good afternoon.
Good afternoon, Annie.
Welcome to the studio.
Thanks for joining us. All right, so let's talk about the whole cancer care itself. Maybe a little bit about Harley Street before we jump into cancer care. Could you just, for the benefit of the viewers?
Well, Harley Street is basically a concept where doctors are actually kind of grouped together with recognition of their various specialties. They are actually kind of in the forefront in terms of expert opinions. Okay, you do find that sometimes it's very difficult for patients to basically look out for certain doctors, especially in the private sector, because you need to literally go around looking for doctors that you presume is actually suitable to look after whatever condition that particular patient perceives he or she to have. Now, sometimes you might even go to a doctor with whose special interest is probably completely different from the actual requirement that you have. Now, what we have in Harley Street is basically we've got a very comprehensive website that patients can actually log on to and look at the various specialties that the doctors are actually kind of specializing in, so that they get a better idea of what the doctors is actually able to basically offer.
What they can go for.
That's right, yeah. And whether this particular doctor they're trying to see is actually someone who's actually suitable to actually meet their needs.
Oh, okay.
All right. Well, what kind of cancer care programs does Harley Street have available?
Well, at the moment, basically in Harley Street, there are a few oncologists who actually work very closely with other specialty doctors as well. The thing with cancer care is actually a multidisciplinary approach to managing patients. It's not just about, I've got cancer, I just have to see an oncologist and no one else. But you do need someone to basically look at your symptoms, requirements. Okay, you might need somebody to even actually explore the psycho-spiritual aspects of difficulties that one might have. So you will need basically a team of doctors and also auxiliary medical staff to basically look after a particular patient with a multitude of problems. With Harley Street, what I do basically, I'm more into a supportive role in the sense that I support a lot of oncologists, surgeons and physicians. I'm a physician myself.
All right.
My area of interest is actually palliative medicine and cancer supportive care. So my role is actually more of a supportive role to make sure the patient is well supported throughout their entire journey of cancer treatment. Because cancer treatment is just not about treating the disease, it's about walking the journey together with the patients, and sometimes not just the patient, it kind of extends beyond that to include their families and carers as well. And this group of people do actually need the proper guidance so that they can actually look after the ill loved ones in a way that's actually the most appropriate.
Well, when we talk about, again, you hit the nail on the spot, extended family. I think that's what a lot of people are looking forward to. When a family member of ours goes through any form of cancer that they suddenly discover, it sort of affects the entire brood as well. In Harley Street, since you mentioned that there is the supportive care, what kind of support do you give for the families? I mean, are we talking about counseling, or is it supportive care where you actually have a group of nurses maybe going to the families and talking to them and the patient as well? How does it work?
I think the entire clinical team, it's not just the doctor itself, but if you do see, someone like myself, for example, I do work very closely with nurses and even psychologists, for example, and we can basically, form a team of medical professionals to basically offer the patient and the family the appropriate support that they need.
Sure.
And each individual has got different, requirements. So we have to basically, tailor our offering to what each individual patient and the family actually requires, and every one of them are different.
Okay.
All right, I believe we have a question right here posted on our Facebook page, and it goes, let me just have a look at it. Okay, this is from Kelly. It goes, my mom's biopsy result is not out yet. The doc did an ultrasound and confirmed she has breast cancer. How accurate, by just doing an ultrasound, that she has breast cancer? Can they determine the stage she is in, or how severe it is from doing or by doing an ultrasound? My mom is 57 years old.
Right. I think a lot of the diagnosis, even in medicine these days, basically, medical science has come a long way. But sometimes we still need to basically, rely on clinical acumen.
Sure.
And, a lot of the diagnosis is actually based on taking a very good history with clinical examination, and a lot of tests are done basically to support your clinical diagnosis. Now, ultrasound is actually a very good way to look at specific organs to give us an idea as to whether certain parts of the body is actually being affected, but it doesn't actually tell us sometimes specifically where the cancer is coming from. So with the ultrasound reports saying that certain organs are being affected, and if it actually fits with a clinical diagnosis that it may be breast cancer, then it actually kind of contributes to the overall information that we doctors use to stage a cancer. Now, it's not specific. It's not 100% objective to say that, yes, this is exactly what you're suffering from.
Sure.
We still need a lot of kind of investigations to basically, kind of give us a whole picture of what's going on.
Okay.
Biopsies to confirm the actual diagnosis, what subtype of cancer it is, whether the cancer is suitable for certain treatment, such as chemotherapy or hormone therapy, for example. Okay, and also, by looking at what other organs are affected, that also helps us doctors to actually have an idea of the disease projection so that we can tailor our treatment according to what we think is in the patient's best interest.
Okay. Well, we're going to take a quick break and come back to the doctor. So no, we're not letting him go yet. We do have a couple of more questions coming in for you out there. If you want to ask a question or two, 2282-8578, 2282-8579. Give us a call, Malaysia. We'd love to hear from you. You can actually, shoot us question to the doctor. Quick breaker, and we'll see you in a bit.
Stay with us.
Wow, okay, not a right thing to show when you're on the show and you're starving like anything.
You know what? If only my stomach could speak French and other languages, it would. It would scream it out. I'm not kidding.
Indian food, you just have to have your banana leaf Indian food. But remember, always use your fingers. There's no point eating Indian food when you use a fork and knife.
Or even chopstick. You know what? I have a question for Annie. You see,
what's that?
When you're done with banana leaf, do you fold it in or do you fold it out? Is there any particular meaning in doing so?
The thing is, it depends on who you're going to, because a lot of Indians believe that when you fold it towards you, it's just to say thank you to the host, to the person who's served you the food, to say it was delicious.
So
I really loved it.
You pull it in, that banana leaf.
You pull it halfway and just put it something, or you push it away from you. What they believe is if you push it away from you, it means you're not too happy about the whole food, and that's a bit disrespectful. Actually, you don't want to do that.
Of course. But
anyway,
it's quite interesting though, the culture. Right?
It is, it is. There's a lot more to it actually, but we'll talk about that later. We do have the doctor back in the studios again. He's going to talk about cancer care, and we have a caller online. Hello, good afternoon.
Hello, good afternoon.
Hi, who's there?
I'm here, Farid Hussein here.
Yes, Encik Hussein.
Okay, I'd like to ask about the tongue cancer here. Okay, what are the signs for the tongue cancer, and what are the treatments, and is it curable?
Okay, so types of lung cancer, treatment, and is it curable? Okay, thank you so much for calling us. There you go.
Well, Well, first of all, I'd just like to clarify that I'm not an oncologist, but I work a lot with cancer patients.
Okay.
So, I come into contact with lots of patients suffering from lung cancers. The thing with cancer is the most treatable type of cancers are the ones that are diagnosed early. Okay, a lot of times, especially in this part of the world, that cancer is actually, diagnosed pretty late, usually stage 3, stage 4. Now, if lung cancer basically is diagnosed early, okay, yes, it is potentially treatable, basically, and depending on which part of the lung is actually affected, and with all the modern kind of a technology in terms of cancer treatment, it is quite possible that at early stages lung cancer can be treated and cured.
Ah, okay. So it is possible if you detect it early, as Usain said. Is it treatable, and is it completely curable? Is that actually completely curable then?
Well, or technically speaking, cancers, if any cancer is detected very early,
You can,
potentially curable.
as long as it's detected earlier.
Yeah.
All right.
All right, moving along now. What are the benefits of good supportive and palliative care?
What I think is actually the most important aspect of good cancer care is good support. You hear a lot of people being terrified of going to cancer treatment.
Sure.
Why are they so worried? Because they are concerned about poor symptom control. They're concerned about being in pain. They're afraid that basically the quality of life is going to be significantly altered, and they feel that there's the concern that there's not enough support to actually help them through treatment. Now, the good thing about supportive and palliative care is basically one can actually really mask the symptoms that's troublesome for the patient, so that he or she can basically go through the actual treatment itself more effectively, and that invariably will make the treatment more effective because there'll be less missed appointments, they have treatments on time, and there'll be less delay in actually going through the cancer treatments, basically.
Okay, Dr. Nick, I have a question. From what you see in your day-to-day visit to all these patients, do you see any difference between a patient who does not get supportive care and ones that get
Probably
supportive
go
care?
through supportive care.
Huge difference, huge difference. And a lot of times patients actually come back to me, or the family actually come back to me saying that they're really grateful that there's adequate supportive care for them. At the end of the day, it's not just about treating the cancer, it's about treating the patient. Okay, and what consists in managing the patient well is basically you manage their expectations, okay, and you also curb their symptoms. Yeah, treating the cancer is one thing, but a lot of times, even with the advancements of medical care, treatment modalities are still very much blunt instruments in this time and age. There will be lots of side effects associated with cancer treatment, and you have to manage those side effects.
Yes.
Because there's no point giving somebody lots of chemotherapy and you're not, look into the chemotherapy literally destroying their quality of life. Yes, you are treating the cancer, but are you treating the patient?
Yeah, that's another question. Now, before we let you go, Doctor, and I know probably we have a lot more calls coming in. Unfortunately, we're quite short of time. A quick advice from you to the people out there about basically cancer care, and if they do have a family member going through any form of cancer.
I think the most important thing is basically don't be afraid to ask for help. Okay, help is always around, support is around, and if there's any concern about any difficult symptom control, ask your doctor about making sure that the symptoms are addressed appropriately, so that quality of life is maintained for whatever one is going through cancer treatment.
And with that
Fantastic.
said, wow.
Yeah, I know. Thank you so much, Dr. Nick.
Welcome.
You have it, ladies and gentlemen. Dr. Nick Chong Chung King, our Consultant Palliative Medicine Physician, Medicine, Harley Street Group, and our topic today.
Yeah, cancer care. So as the doctor mentioned, just remember that whatever happens in the family, there is support out there. Don't ever think that there's no support, there's no place for you to turn to. There's always support out there. All right, now moving on. Now we did say